Good morning. My name is Megha Chokshi, and I'm the Senior Vice President at GovernmentCIO. VA is continuing to provide services remotely and sustaining a quality of care despite the challenges of a expanding pandemic. Congress has also provided VA with a much needed funding to face the pandemic, and as a result of that has enabled new horizons for communicating with veterans and supporting the veteran experience through technologies like remote telehealth, chatbots, and also scheduling vaccines online. So, our panel today consists of three leaders across the veteran experience and IT ecosystem within VA that collectively enhances the digital experience for the veterans. Joining us today is Dominic Cussatt, the Acting Assistant Secretary for Information and Technology and the Chief Information Officer for VA. He oversees the entire IT program, which includes 24/7 IT operations across the US and several overseas territories, 145 hospitals, and over 1,200 outpatient facilities, 56 regional benefits offices, and not to mention 135 veteran cemeteries. That's quite a handful. Welcome, Dom.
Thank you. Very happy to be here. Thanks for having us today to talk about our efforts in light of the pandemic.
Thank you. Next up is Barbara Morton. She is the Deputy Chief Veterans Experience Officer with the VA's Veterans Experience Office. In this role, Barbara, especially in the past year, has been in the forefront of enhancing the veterans experience, working with our digital services team, the VA digital services team, as well as the rest of IT in enhancing and creating a lasting customer experience capability at VA. And of course, sharing best practices across federal agencies. So welcome, Barbara. Always great to see you.
You as well, Megha. Thanks for having me.
Thank you. And last but not the least, Charles Worthington. Charles is the Chief Technology Officer of VA's IT program, and he serves a unique role in not only leading the efforts to improve the experience veterans have when interacting with VA online, but he's also helping OIT adopt to modern digital experience delivery all the way since 2013. So welcome, Charles. Great to see you again.
Thanks for having us.
Thank you all again, and thank you for making the time this morning to be with us. So Barbara, I'm going to start with you. As the part of Veterans Experience Office, last year has been very, very eventful for you. So how, from your perspective, how has last year altered the veterans experience and how is it evolving at the VA? Especially, since VA has been at the forefront of pivoting to much of the day-to-day operations, doing it remotely and taking care of the veterans in a remote environment.
Yeah, no, great question. And certainly we all have lived through a very trying time in the last year. And I think one of the things that I'm most proud of in working with my siblings in OIT and Dom and Charles in particular is really looking back at all the investments that we've already made to allow us to be responsive and agile to this pandemic for veterans. So some of the things that we've done, and Dom and Charles can get into the sort of more techie pieces of it, but we've sort of agreed as a department that we're going to be leading our digital modernization efforts based on experience, based on what veterans are telling us. We're going to design our websites and digital platforms around what veterans tell us are most important and sort of simplify language that we utilize so it's understandable for them. So we've spent the last number of years updating our front door, our digital platform on va.gov, using human-centered design, co-designing that web property with veterans. And what you see is satisfaction with that website has increased by 25% in the last few years. So I say that to say that I think we were very, very poised as an organization, as a team, to respond very agilely to the new needs and new experiences that veterans have had given the last year.
So Dom, on to you. This last year has been pretty monumental for all federal agencies that are supporting, their customers, and especially for VA. VA has come a long way in the way it has advanced its IT ecosystem. So looking back, how has technology positioned, to handle the pandemic? What changes have you made?
So yeah, thank you. We've been working on IT modernization and a VA-wide digital transformation over the past few years. Certainly focusing on that digital transformation over the past 2 years or so. We know that no entity can provide services to their constituents without strong IT. So we, of course, anticipated that and have been spending a lot of time modernizing our infrastructure and building enterprise-wide platforms that we could scale to meet the needs of the VA, including investing in the cloud and looking into telehealth capabilities. We knew telehealth could be a real force multiplier for our clinicians to get out there in the field and reach more veterans. Not all veterans are close to a medical center or a clinic, and we hear that when we are out in the field talking to veterans, veteran service organizations, and our clinicians in the field. You know, they want to reach more veterans want to be reached, and our clinicians want to reach more veterans. So we've been building these capabilities out, but the pandemic has been interesting in that it's really tested what we built out. And where we had telehealth capabilities, sort of nascent capabilities or capabilities that we showed could work, there maybe was a little apprehension to use those services because folks preferred an in-person encounter, and they really sort of lean more towards visiting a brick and mortar facility and being face to face with a clinician or a counselor. So with the COVID pandemic, we really didn't have a choice. So we in IT had to step up and meet an exponentially growing demand. I mean, we saw 10, 20 times volume in telework and telehealth encounters. And it was really a test of those platforms that we built and housed in the cloud that we could scale up and scale out. And it was also a real test of our partnerships with our vendor community to get end user devices and equipment that would broaden our bandwidth and broaden our capacity to provide very rich and robust telehealth encounters and consultations. So, and the network really stood up to it. We were able to not miss a beat, get those capabilities out there to everyone who needed and wanted to use them. And we saw those numbers grow. We went from, thousands of encounters to tens of thousands of encounters a day very quickly. And we've seen those numbers sort of level off. They've risen up, and my point is they're not going back down. People are realizing this is a useful capability, and we're reaching more people, and our customers, the veterans, are really taking advantage of and seeing the benefit of those encounters. So we're going to continue to modernize and continue forward with our digital transformation strategy in parallel with our pandemic remediation. We have about 113 applications already migrated to the cloud, and we've got about 63 in process. This is going to allow us to continue to address issues like the pandemic or natural disasters or any sort of issue, and scale at speed to meet the demand, and have the IT there when we need it, where we need it. And it's also going to position us nicely to take advantage of new AI and robotic process automation processes that will leverage those cloud platforms. So, you heard a lot from Senators Tester and Takano about the money the funds they've invested in the VA, and we really think we're putting some good, solid IT infrastructure in place that will realize some real return on those investments for the veterans.
So, Charles, we have talked about meeting people where they are. So, from a digital experience perspective, what does it mean to you? And, what are we doing to ensure that, the front door, like Barbara mentioned, va.gov, that there are tech solutions in place that serves a diverse population of veterans?
Yeah, great question. And what I love about where we're at with the VA is that all of the technical investments that Dom just explained, veterans don't care about any of that. What they really want is a seamless, easy to use experience. And often what that means in the technology side is just a technology that kind of gets out of the way. It just works. It's kind of not even noticeable because it's so seamless and good. And based on our years-long partnership with our digital service team and the Veteran Experience Office, we were really well positioned to deliver capabilities to veterans in this pandemic that helped meet them where they were. From the earliest stages, when it was as simple as kind of collecting a lot of fast moving information and putting it on a very easy to understand frequently asked questions page, which sounds simple, but it's actually pretty hard to write something like that in a way that is very clear and easy for veterans to navigate, to the chat bot, which we quickly deployed with the help of our health administration colleagues and the experience office to help people quickly ask questions related to the pandemic and take some of the burden off of our contact centers, which were getting a lot of calls, especially early on, all the way forward to the investments we made in making it easier to enter facilities. We did a couple of things to make the screening process of entering a VA medical center work better. I think it took about 12 days to deploy a new questionnaire tool on va.gov that's now in use across the country. It's been used over 10 million times since we launched it over the summer. And text message is another place where we've really invested. You know, a lot of times people think of websites or apps or something pretty fancy, but you know, a lot of veterans use text messaging, and it's a pretty easy way for them to communicate with us. So we've been able to leverage our investments in platforms like VetText and our new VA Notify platform to better support the mission of VHA during this pandemic with better messaging to the veterans about the current state of the pandemic, especially early on. And midway through, we're using VetText to help facilitate safer entry into VA medical centers with the I Am Here kind of check-in experience. In a number of medical centers, veterans can check in by text message and then receive a message back when it's ready for them to kind of come in, to eliminate time waiting in the waiting rooms. And then now, of course, you know, probably the best part of the pandemic so far, right, is the vaccine. Everyone's looking forward to hopefully getting through this in the next few months as we get the vaccine more widely distributed. And that's really been an all hands on deck effort across the VA to try to facilitate the fastest possible delivery of vaccines to veterans. And tech, you know, plays a small part of that. Obviously, the most important part is the experience once you arrive. But we've really tried to make it simple for veterans to understand who the VA is currently vaccinating and make it clear to them how they can get a vaccine. And we've been using text message a lot for that as well, including a very cool two-way text messaging experience where in a number of medical centers that have deployed this, they are actually proactively texting veterans when it's their turn in the priority order, offering them an appointment, and an automated system can respond to their preferred date and time and propose appointments to them. So we've scheduled, I think, over 130,000 first dose vaccine appointments using this automated system, and that saves about 10 minutes per appointment in scheduler time. So that's really helped the throughput of getting some of these vaccine doses scheduled. So we're really trying to, as I said, an all hands on deck effort to support veterans where they are in the digital experience.
And Megha, if I could add one data point to that. So, and I love, you know, the kind of the depth and breadth of all these efforts that Charles and Dom and team have made from an IT perspective. And what you see from an experience perspective, you see that bear out where the trust scores that veterans are sharing with us in terms of, do you trust VA to fulfill its commitment during COVID to veterans? It's at 94%, right? So that is really, that's like an A, I think. So I think technology and the ease of the experience that Dom and Charles and team have created, you know, from basic text messaging to the FAQs on va.gov are really a testament and support what veterans want and what veterans need.
And just, yeah, Barbara and I love riffing off each other, but yep. I think what's especially amazing about that is that we are seeing unprecedented usage of digital tools during the pandemic, telehealth, of course, but also just more basic experiences like coming to the website, logging on, messaging your doctor using secure messaging. You know, I'm looking at our dashboard right now, and in January, we did over 3.5 million successful transactions on va.gov, which is up it's basically up about 100% from the same time last year. And so we're getting a lot more people using VA's digital tools, some of them for the very first time. And at the same time, we're seeing good customer satisfaction scores, which tells us we're doing something right.
Yeah.
Oh, for sure. We've since we support several areas within VA. I mean, we've had some direct contact with our veterans as well, and we've heard that. So for sure. So now I'm going to pivot a little bit. We talk about the direct veterans experience, but we've also changed. VA has also changed how it does things internally
Mhm.
directly in response to the pandemic. And that also has a positive impact on how the VA employees are now interacting with the veterans. So, can you talk a little bit about that on how things have changed from an internal operations angle also?
Yeah, I mean, I'm happy to jump in on that. I mean, I think you hit the nail on the head that, we focus obviously first and foremost on delivery of our benefits and services to veterans and their families. But obviously enabling us to do that, we have to have employees who are engaged and sort of their experiences are taken into account as well. And so from our perspective, the Veterans Experience Office perspective, again, applying human-centered design, which is really sort of my favorite thing to talk about, to really understand the journeys of employees in addition to the journeys of veterans and sort of help us refine our internal operations around that is really kind of where we're headed next. And one of the things that I mentioned before in our prep call was that VA's completed the first ever, I believe in federal government, employee experience journey map. Now, that's a corollary to the Veterans Experience Journey Map that we did back in 2015, 2016. So what we're doing now as we mature as an organization is really applying the same framework of human-centered design, really meeting the employee where they are, understanding the moments that matter most to them, and then making enhancements and changes and designing experiences around what matters most to them. So that's in process and excited to help move the needle on employee experience scores like we have in the customer experience realm.
Yeah, and
So,
oh,
sorry,
I'm
Dom,
sorry,
please
Meg.
go ahead. No, go ahead, please.
I was just going to add to that. We heard earlier Senators Tester and Takano state that in their view and others' views, VA has been one of the most successful in delivering vaccinations in the nation. I mean, that's a pretty high mark to hit, and we're very proud of that. That our staffs stepped up and are really out there delivering this very critical capability to the veterans, and it's really has to be a team effort. It's a very strong partnership between VHA, Barbara's Veterans Experience Office, and OINT to harmonize all the, like, what are the clinical aspects of getting shots in arms and how do we do it safely. There's a huge data component to this. We need to have a single source of information related to the vaccine and who's getting the vaccine and how it's being deployed across the nation. You really have to have solid data to do this safely and effectively and efficiently. We're required to report the data back up to the CDC so we can track on distribution process and make sure we're hitting people we need to hit, and that folks are aware of what percent of the population we've hit. Charles talked a lot about the veteran-facing communications. That's a huge partnership between, getting the data from the VHA out to the veterans about appointment availability and mechanisms to get shots and facilities to get them, and then us working with the Veterans Experience Office to understand how the veterans want to ingest that information and what works for them, how's best to reach them, how's best to get them to the facilities. It's not always it doesn't always mean the most high tech 22nd century even solution with high bandwidth video capabilities and messaging. Sometimes it's the real low bandwidth, low tech solutions, if arrayed properly, can hit the most veterans. And all veterans don't have necessarily very high end IT equipment on their side or high speed internet connections. So sometimes it's the lower tech, texting, chat bots, the Keep Me Informed tool that allows texting that allows two-way communication. Those seem really simple, but if they're easier to deploy and they're easier for the veterans to ingest. So for us working with VEO and working with VHA kind of leverage some of these lower tech solutions that take advantage of our high tech platforms that can get the delivery of the low tech out, it's harmonized very well. So again, we're very happy and proud that we're able to so effectively roll out the vaccination effort.
Great. So, we had talked about equity a lot yesterday and, how remote communities within US are, have been impacted by the pandemic. And, we just kind of touched on this, on the technology not being quite there. But outside of that, from a true experience perspective, and Barbara, this may be, a segue to you and Charles first. What do you really take into account outside of what Dom mentioned? Is there anything else specifically from a veterans experience angle that you have to look at to make, number one, reach every single, strata of veterans out there, different age groups, different technical savvy, as well as, just sometimes they're going through a lot of different things. So, how do you make sure that you're reaching out to them every single time?
Yeah, no, absolutely. I mean, we have a privilege of serving so many different types of veterans with many different backgrounds and experiences. And I think one of the things that human-centered design in particular and a focus on experience does is it enables us to not just focus on sort of a one size fits all, but it allows us to recognize there are different experiences and needs with different groups and different veterans, right? So I think that's where the value of doing research and talking to different cohorts of veterans will really allow us to make those adaptations and meet them where they are. And the needs may be very, very different. And so we want to be accommodating to that. One of the things that I'm particularly excited about with the Equity and Underserved Populations Executive Order that the president signed literally on day one is to really showcase the power of experience to meet that aspiration. And so one of the things that we are doing in our office is starting to dive a little bit deeper into certain underserved populations. Tribal veterans, for example, we're going to be doing a human-centered design sprint to really understand the experiences of that population when they interact with VA. Women veterans is another area that we've been diving into with journey mapping and research. And what we do is when you talk to your customers and really understand their journey, you're able to then sort of prototype and test tangible tools and adaptations to meet them where they are and to really specifically address their needs. So again, beating the drum of application of human-centered design is really the starting point, I think, for us to be able to address those needs.
2 points I would love to add to that is, one is that on the digital front, one thing that is often kind of forgotten in the private sector, but that we really try to take very seriously here at the VA is making the digital technology work well with assistive devices, things like screen readers for low vision veterans. And this is, it's not something that the industry as a whole does very well, but we've really tried to invest in making the VA.gov platform, relatively easy to use on platforms like that. And that is, it's a challenge, but it's important because we know that there's many different types of veterans that want to access this information digitally. We want to make it available to all those folks. And the other point I would say is, sometimes there's a misconception that, because the veteran population that we serve skews older, they're not as comfortable with technology. And I really think that is maybe an old trope that is not as appropriate. Certainly not everyone wants to interact using technology, but we do see that we've got very high penetration of some of our digital tools among all ages of veterans. And so I think one of the powers of the digital channel is that for those folks that want to interact digitally, if we can provide a great experience, that gives them a way to do that via self-service. And that frees up all the other channels that we have to interact with people that don't like the digital to do an even better job. So that's something, another kind of missed point of digital sometimes is that even the folks that don't use digital benefit from it because it's kind of cleared up the lane for the people that did prefer digital. Now they're not taking up, a time with a contact center agent because they preferred to do it online. That contact center agent is therefore more able to more quickly answer a call from someone that really prefers to talk with someone. And my energy efficient lights just keep turning off. So I got to move around more in here.
Well, so Charles, you had talked about seamless experience, and as we are coming to the end of this panel, so wanted to, before we talk about great things that are in store, I wanted to touch on something that you had mentioned yesterday too, and I believe it was mentioned on the panel right before us as well. There is going to be a lot of debt forgiveness for veterans, and it's a tool, the debt management tool, center tool that was just released on va.gov, has been very well received, and seen a lot of interest. So can you talk a little bit of that? How have you tried to take something that is so on the outlines of the veteran experience, right, and kind of move it into the mainstream va.gov and still give veterans what they really are looking for in the end?
Yeah, it's a great question. I mean, I think one of the things that is challenging to provide a really great experience at the VA is because the business lines at the VA tend to be quite siloed. It makes a lot of sense for operational efficiencies, but from a veteran's perspective, they don't think of the idea that, well, we have one part of the VA that handles debts, and we've got a different part that handles enrollments, the different part that handles education benefits, and so on and so on. They tend to think of the VA, they've told us that with research that Barbara's team helped us do. They've told us that they think of the VA as just the VA, and they get very frustrated when we present ourselves in these silos. So the debt management feature on va.gov is a great example of that, where we were able to kind of pull an experience that had not yet really been modernized for the digital era, and now make it accessible to veterans to be able to view the outstanding payments that they owe the VA, and more easily track and manage those. So obviously in the new legislation, I think, is giving VA a lot of flexibility to forgive or waive co-payments during the pandemic, which is really great. That was a big part of the bill that Senator Tester and Chairman Takano just discussed. But the feature to manage debts, I think it's great to be able to pull that and put it right alongside features like managing your appointments, or applying for an education benefit, or updating your mailing address, right? These are all capabilities that veterans believe and think of as just VA services. And the hard part of the digital world and the IT world that Dom has talked a lot about is kind of hiding all that complexity from the veteran, so that they just experience one kind of seamless, easy to understand, integrated experience. We want to hide the complexity of VA's organizational design from the veterans and service members and family members that depend on us for services.
That's great. Thank you, Charles. So as we wrap up, question for all three of you. What's next? What's on the horizon? What are you most excited about that you would be doing something in the future, not only in response to the pandemic, but what you see as sustainable change at VA?
Well, I could start maybe is, I think the growth we've seen in the use of digital products, telehealth being probably the biggest example, but really all of our digital products, I believe that that's really going to stay consistent. I think that once people have gotten familiar with that and see the benefits of interacting digitally, I expect there's kind of a new baseline that is going to be higher than it was before the pandemic, in some cases much higher. And so there's a challenge there, which is we sort of need to rethink some of our experiences with this assumption of a higher baseline, and better integrate those experiences more tightly together. And one example of that I'm really excited about thinking through is how to best serve veterans that are accessing VA digital services on mobile devices. We're seeing an increased use of smartphones to access VA tools online. And we're looking at ways to make that experience even more awesome with the help of Barbara's team. So hoping to have some bigger announcements on that later this year.
Yeah, and I'll jump in there, and we'll let Barbara have the last word, because it should always end with the veterans experience, right?
Yeah.
So yeah, I agree with Charles. There's no going back at this point. We've equipped our over 400,000 person workforce with telehealth, telehearing, telecounseling capabilities, and they now are very skilled at it, and they're not going to go back. And our veterans are now very used to getting those services. We've not only seen an increase in the numbers of veterans we can reach, much, but we've seen increases in our productivity. You would think moving to telework, we might see a hit to productivity, and in many areas we've seen productivity increase. So this is something that's going to be around for a while. So I see from an IT perspective, it's going to be about building on that. Now that we have these in place, we can leverage AI, robotic process automation, APIs to really take those teleservices up to the next level and could continue to make that veteran experience better and better.
Well said. And to round us out, just to reiterate, the power of human-centered design and the experiences we provide, understanding what veterans need and adapting to those needs. And experience has been no more important than now in COVID. It's enabled us to really pivot with the infrastructure, as Dom and Charles talked about, that we instituted at VA. So leading with experience is always going to produce better results for veterans, and excited for the future with that in mind.
Well, thank you all. As always, I thoroughly enjoyed the conversation, and I'm looking forward to continuing this in the future as well. So now I would like to hand over to my colleague, Amy Kluber, as she chats with Dr. Stone. And thank you again.